malleolus, here's the peroneal retinaculum. It accommodates the tendons of two peroneal muscles as they pass around the lateral malleolus. On the medial side, the flexor retinaculum fans out from the back of the medial malleolus. The space beneath the flexor retinaculum is divided into 4 separate tunnels. 3 tendons and the posterior tibial vessels and nerve pass through these tunnels as they pass around the ankle and into the foot. Now let's review what we've seen of the bones, joints and pulleys of the ankle region. Then we'll move on to look at the muscles of the leg. Here's the tibia, the fibula, the medial malleolus, the lateral malleolus, the talus, and the ankle joint. Here's the interosseous membrane, the proximal tibiofibular joint, the distal tibiofibular joint, the posterior tibiofibular and talofibular ligaments, the anterior tibiofibular and talofibular ligaments, and the deltoid ligament. Here's the calcaneus, the cuboid, the 3 cuneiform bones, and the navicular. Here are the surfaces for the subtalar joint and for the TCN joint. Here's the calcaneo-navicular ligament, the calcaneo-fibular ligament, and the interosseous talocalcaneal ligament. Here's the extensor retinaculum, the peroneal retinaculum, and the flexor retinaculum. Now we'll move on to look at the muscles that produce movement at the joints of the ankle region. In doing this, we'll meet most, but not all, of the muscles that are in the leg. There are 4 muscles that are in the leg, which we'll leave out of the picture till the next section. These are the long flexors and the long extensors of the toes. Along with the muscles, we'll meet the various layers of deep fascia, which divide the muscles of the leg into rather distinct compartments. We'll start with the muscles that produce dorsiflexion and plantarflexion at the ankle joint. Next, we'll look at the fascial layers and compartments. Lastly, we'll look at the muscles of inversion and eversion. First then, the dorsiflexors and plantarflexors. Dorsiflexion involves just lifting the foot. Plantarflexion involves lifting the whole body. So it's not surprising that the muscles for plantarflexion are much larger than the ones for dorsiflexion. There's one muscle on the front of the leg for dorsiflexion, tibialis anterior. There are 3 on the back of the leg for plantarflexion, gastrocnemius, soleus, and plantaris. Here's tibialis anterior. Tibialis anterior arises from the lateral surface of the upper tibia and from the interosseous membrane. The tendon of tibialis anterior passes under the extensor retinaculum and winds around the medial side of the tarsus to insert right down here on the first cuneiform bone and on the base of the first metatarsal. The main action of tibialis anterior is to produce dorsiflexion at the ankle. Dorsiflexion is not the only action of tibialis anterior. It also has a role in producing inversion, as we'll see shortly. What's more, tibialis anterior is not the only muscle that produces dorsiflexion. It's assisted in that by the long extensor muscles for the toes, which we'll see in the next section. We'll move on now to look at the muscles that produce plantarflexion. 2 large muscles, gastrocnemius and soleus, and 1 small muscle, plantaris, join together to form the massive calcaneal tendon. Here's gastrocnemius. Here, deep to it, is soleus. Gastrocnemius has two heads, a medial and a lateral. These arise, as we've seen, from the medial and lateral condyles of the femur. The two heads of gastrocnemius unite, forming a flat tendon. The gastrocnemius tendon, in turn, unites with the tendon of soleus to form the calcaneal tendon. To look at soleus, we'll remove gastrocnemius. Here's the whole of soleus. Here's its medial border. Here's its lateral border. Here's the cut edge of the gastrocnemius tendon. Soleus arises from the medial edge of the tibia, from this oblique line on the back of the tibia, and from this area on the back of the fibula. Between the fibula and the tibial origins of soleus, there's an arch of fibrous tissue. The popliteal vessels